Heart attacks are a major cause of death around the world, including in the USA. They often come with warning signs that we can learn to recognize. By knowing these signs, we can act quickly to prevent serious harm or even death. Today, we will talk about 9 important symptoms that might signal a heart attack is coming. Understanding these signs can really make a difference. We'll go through each symptom clearly so you know what to look out for. This isn't just good to know, it could actually save lives. Stay with us as we go over the signs your body gives before a heart attack and learn how to protect yourself and others. Number 1, unusual fatigue. Unusual fatigue is a critical yet often overlooked symptom of a heart attack. Unlike normal tiredness that comes from exertion or a lack of sleep, unusual fatigue is profound and disproportionate to the activity performed. It can manifest as a sudden, inexplicable weakness, making everyday tasks feel extraordinarily exhausting. For example, activities such as making the bed, walking to the mailbox, or even engaging in a casual conversation might become unexpectedly difficult. This type of fatigue occurs because the heart is struggling to pump blood efficiently due to blocked arteries or other heart problems. When the heart cannot pump effectively, it delivers less oxygen and fewer nutrients to the tissues of the body, including the muscles. This lack of oxygen can cause a feeling of severe tiredness and a decrease in stamina, signaling that something is seriously wrong. The subtlety of unusual fatigue can make it easy to dismiss as just a bad day or an off moment. However, it is essential to pay attention to this symptom, especially if it appears suddenly or is accompanied by other concerning signs such as chest discomfort, shortness of breath, or dizziness. Women in particular may experience unusual fatigue as one of the primary symptoms of a heart attack, sometimes without the classic symptom of chest pain. If you or someone you know is experiencing this kind of profound fatigue without an obvious cause, it is important to consider it as a potential warning sign of a heart attack. Consulting a healthcare provider to discuss these symptoms can be a crucial step in preventing potentially fatal heart issues. Number 2, chest discomfort. Chest discomfort is one of the most recognizable and significant indicators of a heart attack, often prompting immediate concern. This symptom isn't always a sharp or piercing pain. It can manifest in various forms, such as a feeling of pressure, fullness, or a squeezing sensation in the center of the chest. The discomfort may last for several minutes, disappear, and then return, or it might persist more continuously. Such sensations should not be taken lightly, as they are a common sign that the heart may not be getting enough oxygen due to narrowed or blocked arteries. The nature of the discomfort can vary from person to person. Some might describe it as feeling like an elephant is sitting on their chest, while others might compare it to indigestion or heartburn. This variability sometimes leads to delays in seeking help, especially if the discomfort is mild or mistaken for a less serious condition. However, any unusual chest sensation warrants immediate attention, especially when accompanied by other symptoms like shortness of breath, cold sweats, nausea, or lightheadedness. Importantly, chest discomfort associated with a heart attack does not necessarily need to be provoked by physical exertion. It can occur while at rest or even during sleep. This aspect can be particularly alarming and confusing for those experiencing it. Understanding this symptom's seriousness and recognizing its potential variability is crucial. Immediate action can be the difference between life and death. Calling emergency services at the first sign of such chest discomfort ensures prompt medical intervention, which is critical in minimizing heart damage and improving survival rates. Thus, being educated about this and other symptoms of a heart attack is essential for everyone, enabling quicker decisions and more effective responses in potential heart attack scenarios. Number 3, shortness of breath. Shortness of breath, also known medically as dyspnea, is a significant warning sign of a heart attack that should never be overlooked. This symptom occurs when the heart is unable to pump blood efficiently, leading to a reduced oxygen supply to the lungs and the rest of the body. As a result, you may experience difficulty breathing or feel as though you can't get enough air, even when you're at rest or performing tasks that usually wouldn't cause you any trouble, such as walking slowly or climbing a few steps. This troubling sensation of being unable to breathe deeply enough can suddenly onset or develop gradually. In the context of a heart attack, shortness of breath often accompanies other symptoms like chest discomfort or fatigue, but it can also occur on its own, especially in women. The experience might feel like a tightness in the chest or as though something is squeezing your lungs, making it hard to breathe in enough air. The critical aspect of this symptom is its potential to worsen quickly, signaling an urgent need for medical attention. If left unaddressed, inadequate oxygenation can affect vital organs and lead to severe complications. In some cases, shortness of breath is also a sign of heart failure, a condition where the heart is unable to pump effectively. causing fluid to back up in the lungs. If you or someone else experiences sudden or severe shortness of breath, especially if it's combined with other symptoms of a heart attack, it's crucial to call emergency services right away. Quick response and treatment can significantly improve the outcome and could be life-saving. Recognizing and responding to this symptom promptly ensures the best possible care and highlights the importance of understanding and being attentive to the body's signals. Number 4, cold sweat. Cold sweat is another alarming symptom often associated with a heart attack that should not be ignored. It occurs when you suddenly break into a sweat without any obvious reason, like heat or physical exertion. This type of sweating is an acute stress response from the body, signaling that something abnormal is happening. In the case of a heart attack, the sweat is typically cold and clammy, and it might make you feel unusually uncomfortable or uneasy. This symptom generally arises when the body is in distress, particularly when there is insufficient blood flow, due to a blocked artery affecting heart function. The nervous system reacts to this stress by stimulating the sweat glands, leading to a sudden, noticeable sweat. This is your body's way of trying to cool down during what it perceives as a critical situation. A cold sweat during a heart attack is often accompanied by other symptoms, such as chest pain or discomfort, shortness of breath, nausea, or lightheadedness. However, it can also occur on its own, making it crucial to recognize and respond to it as a potential sign of a serious problem. The sudden onset and the nature of the sweat, cold rather than warm, help distinguish it from sweating due to environmental factors or physical activity. If you experience a cold sweat along with any other symptoms suggestive of a heart attack, it's important to treat it as a medical emergency. Calling emergency services immediately can ensure that you receive the necessary medical attention quickly. Prompt action is vital to address the underlying cause of the sweat, which in cases of a heart attack is often life-threatening. Recognizing a cold sweat as a potential sign of heart distress and responding swiftly can make a significant difference in the outcome. Number 5, nausea or indigestion. Nausea or indigestion can sometimes be more than just a simple stomach upset. They can also be signs of a heart attack. This might be surprising, as these symptoms are commonly associated with less serious conditions, such as a viral bug or digestive troubles. However, during a heart attack, digestive symptoms like these can occur due to the heart's inability to pump blood effectively, which can affect the proper functioning of other body systems, including the gastrointestinal tract. The reason these symptoms appear is often related to the nerve connections between the heart and the stomach. When the heart experiences stress, such as from a blocked artery, signals may be sent that disrupt the normal functioning of the digestive system. This disruption can lead to feelings of nausea, vomiting, or an overall indigestion sensation that doesn't seem to be linked to any recent meal or dietary change. Importantly, these symptoms can manifest differently in different people. Some might experience severe cases of heartburn or a feeling of fullness in the upper abdomen, which are often mistaken for regular indigestion. However, when these symptoms are part of a heart attack, they typically do not respond to antacids or other common gastrointestinal treatments and are usually accompanied by other signs of a heart attack, such as chest pain, shortness of breath, or cold sweats. Recognizing nausea and indigestion as potential heart attack symptoms is particularly crucial for women, who are more likely than men to experience these less typical symptoms during a heart attack. If you or someone you know experiences sudden nausea, vomiting, or indigestion, especially if combined with other heart attack signs, and there's no clear reason for these digestive symptoms, it's important to seek medical attention immediately. Treating these symptoms as potential indicators of a heart attack could be life-saving, emphasizing the need for prompt action and awareness of the broader range of possible heart attack symptoms. Number 6, lightheadedness. Lightheadedness is a symptom that might not immediately raise alarms as a sign of a heart attack, but it is important to recognize it as a potential indicator, especially when it occurs in conjunction with other symptoms. This sensation typically involves a feeling of dizziness or being about to faint. It can be caused by a decrease in blood flow to the brain, which occurs when the heart isn't pumping blood as effectively as it should. When the heart's ability to pump blood is compromised due to blockages or malfunctions within the cardiovascular system, vital organs including the brain may not receive enough oxygen-rich blood. This shortfall can cause you to feel suddenly weak, dizzy, or as if you are going to pass out. These feelings of lightheadedness can be particularly alarming if they occur suddenly or are accompanied by chest pain, shortness of breath, or irregular heartbeats. It's crucial to understand that while lightheadedness can be caused by many less serious conditions, such as dehydration or sudden movements, its occurrence in the context of heart issues must not be overlooked. This is particularly true if the symptom appears unexpectedly and is combined with other concerning signs. For instance, if you feel dizzy while also experiencing discomfort in your chest or an abnormal heartbeat, this could be a sign that your heart is struggling to supply blood effectively. In such scenarios, prompt medical attention is essential. Recognizing and responding to lightheadedness as a possible symptom of a heart attack could help prevent more severe complications, including full cardiac arrest. If you experience this symptom, particularly if it's unusual for you and associated with other symptoms of a heart attack, seeking emergency care is critical. It's better to be cautious and have a false alarm than to underestimate a serious cardiovascular event. Number 7. Arm or jaw pain. Arm or jaw pain can be unexpected symptoms of a heart attack, often surprising those who experience it because the discomfort may not seem related to heart issues at first glance. These symptoms occur due to referred pain, where pain from the heart is felt in other parts of the body due to shared nerve pathways. Understanding the connection between these symptoms and heart attacks can be crucial in recognizing a heart attack early and seeking prompt medical attention. During a heart attack, the pain typically starts in the chest and then radiates outward. In the case of arm pain, it is most commonly felt in the left arm but can affect either or both arms. The pain might feel like a deep ache or a squeezing sensation that comes and goes or remains constant. Similarly, jaw pain associated with a heart attack is often described as a sudden ache that feels like it's radiating from deep within the bone rather than the surface-level pain, such as that caused by a dental problem. These symptoms are particularly deceptive because they can easily be mistaken for other issues, like muscle strain in the arm or temporomandibular joint disorder, TMJ, in the jaw. However, if the pain is unexpected, does not have a clear cause, and is accompanied by other symptoms like chest discomfort, shortness of breath, or lightheadedness, it's important to consider it as a potential heart attack. Arm and jaw pain due to a heart attack require immediate medical evaluation. If you or someone else experiences these symptoms suddenly, especially if they're unusual and you haven't been exerting yourself physically, it's critical to call emergency services right away. Prompt medical intervention can be life-saving and significantly improves the chances of a good recovery by ensuring that heart damage is minimized. Number 8. Swelling. Swelling, particularly in the legs, ankles, feet, or abdomen, is another important symptom that can indicate heart problems, including heart attacks. This symptom is often a sign of fluid retention, which happens when the heart is not pumping blood effectively. When the heart's function is compromised, blood flow slows down and can back up in the veins, leading to fluid leaking into surrounding tissues and causing swelling, also known as edema. Swelling in the lower extremities is a common sign that the heart is struggling to circulate blood properly. This kind of swelling is typically noticeable at the end of the day or after periods of prolonged sitting or standing. The ankles and feet might appear puffy, and pressing on the swollen area may leave an indentation, a condition known as pitting edema. Swelling in the abdomen or ascites can occur when fluid builds up in the abdominal cavity. This can lead to discomfort, bloating, and a feeling of fullness. Ascites can be particularly concerning as it might indicate more advanced heart failure or other severe cardiac conditions. Swelling related to heart issues is often accompanied by other symptoms, such as shortness of breath, fatigue, or chest discomfort. It might develop gradually or appear suddenly and should not be ignored, especially if it's new or worsening. Unlike swelling from injuries or other causes, edema linked to heart problems usually affects both legs and is persistent. The heart's inability to pump blood efficiently means that blood can start pooling in certain areas, particularly in the lower parts of the body due to gravity. This pooling increases pressure in the veins and causes fluid to leak out into the surrounding tissues, leading to visible swelling. If you or someone else experiences unexplained swelling, particularly if it is accompanied by other signs of heart trouble, it's important to seek medical advice promptly. This symptom could indicate heart failure or an impending heart attack, both of which require immediate medical attention. Early intervention can help manage the underlying condition and prevent more serious complications. Number 9. Persistent cough. A persistent cough, especially one that produces white or pink mucus, can be a significant warning sign of heart problems, including heart failure, which can accompany or precede a heart attack. This symptom arises because of fluid buildup in the lungs, a condition known as pulmonary congestion or pulmonary edema. When the heart is not functioning efficiently, blood can back up into the veins that carry blood from the lungs to the heart. This increased pressure in the blood vessels forces fluid into the air sacs of the lungs, leading to a persistent cough. Characteristics of the cough, such as duration. This cough tends to be chronic, lasting for weeks or even months. Type of mucus. It often produces a frothy, white, or pink-tinged mucus due to the presence of blood. Sound. The cough might be accompanied by wheezing or a rattling sound, indicating fluid in the lungs. When the heart cannot pump blood effectively, blood flow backs up, causing fluid to accumulate in the lungs. This fluid irritates the airways and leads to a persistent cough. This condition is particularly concerning as it indicates that the heart's ability to handle blood flow is compromised, potentially leading to heart failure. A persistent cough related to heart issues often comes with other symptoms such as shortness of breath, difficulty breathing, especially when lying flat or during physical activity, swelling, edema in the legs, ankles, or abdomen, fatigue, extreme tiredness and lack of energy, chest discomfort, pressure or pain in the chest area. It's easy to mistake a persistent cough for a respiratory infection or chronic bronchitis. However, if the cough is accompanied by the symptoms mentioned above, it could indicate a more serious heart condition. This symptom should prompt immediate medical evaluation, particularly if it's new or worsening, to rule out heart failure or an impending heart attack. If you experience a persistent cough along with any other signs of heart distress, it's crucial to consult a healthcare provider as soon as possible. Immediate medical attention is essential to manage the underlying condition and prevent severe complications. Recognizing and not ignoring symptoms like unusual fatigue, chest discomfort, shortness of breath, cold sweat, nausea, lightheadedness, arm or jaw pain, swelling, and a persistent cough is crucial. These signs can indicate a heart attack or serious heart problems. Early detection and immediate medical attention can prevent severe damage and save lives. Acting quickly when these symptoms appear can significantly improve outcomes, ensuring better recovery and quality of life. Understanding these symptoms empowers you to take prompt action. By being aware, you can help yourself or others avoid the worst consequences of heart issues. This knowledge is vital for everyone, as heart attacks can affect anyone, regardless of age or gender. Please share this video with your loved ones to spread awareness and potentially save lives. Stay informed about heart health by subscribing to our channel for future updates and valuable information. Together, we can make a difference in recognizing and responding to heart attack symptoms promptly. Your actions today could be life-saving tomorrow.